what is HCM? HCM is hypertrophic cardiomyopathy. It's a heart condition in which, rather than having problems with weak heart, the problem is that the thickness of the muscle of the heart is too much. And this can cause problems like abnormal heart rhythms, symptoms such as shortness of breath, dizziness, lightheadedness, or passing out, and other problems like that. In some percentage of patients, probably about 2/3 of the ones that we see in clinic, HCM doesn't just affect the person in front of us, but actually runs in the family and can have other family members, parents or kids or brothers and sisters that are also affected. And that can often be because of abnormalities in the genetic code that helps the body construct the muscle of the heart itself. So we can look for those abnormalities in genetics using genetic testing to figure out if there's something that we can test those family members to see if they are also at risk for hypertrophic cardiomyopathy. Genetic testing is a test that's specifically designed to look for those gene abnormalities that encode the protein that build up the muscle of the heart. And it's actually really easy to do, much more so now than ever before. The way we do it at Hopkins is typically with a cheek swab, where you swab your cheek and send it in the mail, and then we analyze that DNA to look for these very specific abnormalities in hypertrophic cardiomyopathy genes. And we use that for a couple of different things. The first is to help us confirm the diagnosis of hypertrophic cardiomyopathy if we're worried that it might be something else that's like hypertrophic cardiomyopathy but not quite treated the same way. Sometimes this genetic testing can help. And then the other big place is helping to screen family members. So if you have hypertrophic cardiomyopathy and you've got a young a son or daughter who might be at risk, we can use your positive genetic test to then look at your kids, each of which would have about a 50-50 chance of inheriting that same mutation that you have. Genetic testing is really, I think, most useful for that exact situation that you're talking about, which is screening of family members. There are two ways to see if somebody's affected by hypertrophic cardiomyopathy. One way would be to do testing like echocardiography or EKG or other imaging tests to see if that person actually has hypertrophic cardiomyopathy. But we would have to repeat that again and again over time, sometimes over decades of time. Whereas if the affected patient has a positive genetic test, we can then look for that same mutation in their children. And if they're negative, we basically don't have to do any of that longitudinal testing. So it can be really helpful to exclude risk for developing disease in family members.